Hi, my name is Marc Dean. I'm a physician here in Dallas Fort Worth area, and I've been practicing here for about 5 years. I originally came from Shreveport after doing my fellowship in Otorhinology and have been here ever since. So my practice really orients around diseases of the ear and sinus, and the focus is mainly on the eustachian tube that ties the two together. I have a expertise in surgical treatment of the eustachian tube, both with the two closed and two open. Probably the biggest focus of my practice is the eustachian tube disorders. Up until recently, there's not been any kind of surgical or medical management. Mainly treatment is focused on basically bypassing the symptoms such as tubes or chronic ear disease, where you do have your eardrum repaired or other things. And recently we've been able to find some treatments involving balloon dilation that are promising to basically treat the cause and the function to hopefully prevent most of the complications and sequelae that occur over time. Well, children will be the biggest probably benefactor of this over time. The research is done mainly in adults to kind of prove effectiveness. We just finished a large randomized controlled trial that looked at the effectiveness in a controlled trial with a crossover, which the final results are being tabulated right now, but my personal results are such that highly successful. And if that proves to be the case, the next step will be to do research in kids, because this will eventually replace tubes or be a alternative treatment for tubes, potentially. Otolaryngology in the United States is basically the treatment of ear, nose, and throat disorders, as well as any kind of head and neck, thyroid, cancers, things like that. I personally have kind of limited my practice to disorders around the eustachian tube and really the nose and the ear portion of the specialty, and I do significant sinus surgery, middle ear surgery, as well as surgeries involving the eustachian tube. Due to a lot of my work with telemedicine and humanitarian missions across the United States and the world, we've been looking for ways to extend our ability to operate across regional and state borders, which turned us to robotics. Through that, I got involved with NASA, working on a humanoid robot for a operative platform, which will then hopefully allow us to do multiple surgeries across platforms, whether it be open trauma versus endoscopic cases from a distance. And this has also led me into being on a team of surgeons that have begun to put together recommendations for the surgical capabilities for the mission to Mars, as well as for colonization of the moon. Well, I think standards and really evidence-based medicine in general is what's beginning to drive the future of medicine and understanding what works and what doesn't. You know, for the longest time we've been really an apprenticeship program, and it's just kind of this is the way I've done it, this is the how, and we get into our own little routines and patterns. But one of the things that this trial that I've been involved in has really shown us is that, you know, despite paradigms or paradoxes that we believed in, that there are new procedures that are actually quite effective, and it's going to be the evidence that drives it, not necessarily what we feel comfortable with. It's important to know that someone else validates what you do. I mean, as a surgeon, we always like to be told that we're good, and it's always nice that it comes from objective measures, not just, you know, a lot of physicians or patients will write recommendations online that talk about an experience, but it's just kind of like a case study. It's one experience doesn't necessarily mean anything. It's more of the aggregate, and once you actually look at the data, sometimes it's a little bit different.